Since children are in a constant state of growing, it's important for early intervention to correct or repair any orthopedic issues that may arise. Dr. Afshin Aminian of Children's Hospital of Orange County explains the various orthopedic problems and treatments for these conditions.
What I think is very important when we talk about adolescent, when they're in their peak growth velocity, and this is the time when the bone density is changing and the bone is maturing and the architecture is going to mature into their adult bony architecture, is that we really stress the importance of bone nutrition. So especially for female teenagers, it's very important in their teenage lives when they are kind of at the point that they could build bone density, to build their bone density, because once they hit 18, they're going to be some loss in that bone density, and then soon after menopause, a rapid loss in bone density. What we stress in every teenager that comes in, no matter for a back problem, a hip problem, a knee problem, is the importance of adequate calcium intake. About 5 cups of milk a day or equivalent of that, 1,800 milligrams is what they need. And that could be obtained from drinking milk, orange juice with calcium, dairy products, cheese, broccoli is a great source. So we stress to the families that, make sure that they're getting adequate calcium intake with about 5 healthy doses of dairy products a day. Then it's exercise. 1 hour exercise a day is absolutely necessary for bone nutrition. That stimulation of weight-bearing activities on the bone is essential for the bony architecture and the mineralization to proceed in a good, healthy fashion. When the teenagers are going through their rapid growth phase, they get awkward. So they're getting really tall, they get clumsy. The girls and the boys are going through hormonal changes, and unfortunately, due to the hormonal changes, the weak link in their skeleton becomes their growth plates. If they're active in football and basketball and they turn and twist, unfortunately they end up with a fracture through the growth plate. The importance of seeing a pediatric orthopedics with a growth plate injury is that a lot of these children end up with potential problems with asymmetry in their growth secondary to the trauma. That if these do arise as we follow these children, there are sometimes minimally invasive techniques. There are currently the latest sort of techniques that we're doing in pediatric orthopedics for growth modulation, that we are very sensitive in even 5 to 10 degrees of angular deformities at the knees and the hip that could potentially cause osteoarthritis 20, 30 years down the line. And we do have recent techniques in pediatric orthopedics to be able to align these fractures a little bit better, align the joint surface better, so we diminish the possibility of arthritic changes developing in these teenagers when they become young adults. So we're seeing an increased number of athletic injuries as far as knee, ligamentous injury, cartilage damage in young female teenagers. We do see the increased incidence of injuries, and that has started us to really look at these girls for pre-participation physical exam, look at their alignment, and through dynamic neuromuscular training with better control of their knees and hip musculature, be able to teach them how to pivot, jump, land, and turn to prevent some of these injuries from occurring, which is sort of the major advances that I think we've made in pediatric orthopedics in the past 5 or 6 years, because we're seeing just more and more adult type injuries in 12, 13-year-old girls, which it's a pity, I think.